Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Lagos COVID-19 cases to peak in August. State Commissioner for Health also warns against use of rapid test kits to test for coronavirus. Akiti State Governor Dr. Akiti State advises Nigerians not to doubt reality of COVID-19. And Uganda registers its first death from the coronavirus. And President Muhammadu Buhari has made his first trip since the outbreak of COVID-19 to Bamako in Mali. The president arrived the city meeting other West African leaders in a high-stakes mission aimed at diffusing Mali's political crisis that has raised concerns of further instability in the country. The ECOWAS region continues to record a rise in coronavirus cases, with Nigeria recording the highest cases in the region, followed by Ghana, Cote d'Ivoire, Senegal and Guinea. Now, the region has so far recorded a total confirmed cases of 111,148, with 69,410 recovering, while 1,780 people have died. The total number of active cases in the West African region is 39,958. In the meantime, at the virtual meeting of the second extraordinary session of the ECOWAS Parliament, two proposals were made on the standards for quality control of face masks and sanitizers produced by the 15 member states for harmonization of COVID-19 prevention. According to members, standardizing local production of face masks, hand sanitizers will ensure quality control and the effective prevention of the spread of COVID-19 pandemic in the region. The Nigeria Center for Disease Control (NCDC) confirmed 543 new cases of COVID-19 and 8 deaths in 24 hours, putting the total confirmed cases at 38,344. According to its coronavirus situation report 145, while 15,815 cases have been discharged, the death toll stands at 813. 8 deaths in 24 hours were recorded in 4 states, 4 in Edo, 2 in Ebonyi, 1 in Abia, and another one in the Federal Capital Territory. The 543 new cases are reported from 15 states, including the FCT. The center also updated its interim guidelines for COVID-19 home-based care as it continues to provide evidence-based guidelines based on evolving knowledge. Total active cases in Nigeria stands at 21,716, while total samples tested across the country is put at 251,893. By August, Lagos State should reach its peak of COVID-19 cases. This is according to the State Commissioner for Health, Professor Akiti State, while giving an update on the management of the virus in the state. He also says that any private health facility found conducting COVID-19 tests without approval or using the rapid test kits will be sealed.
We're still seeing a gentle increase in the number of cases over time, cumulatively. According to our modeling, we expect that Lagos will theoretically peak in the month of August, and then it will flatten out, and after some time, we will start to see a decrease in the number of cases. Nobody has developed a rapid diagnostic test that is safe enough for us to use in community. We will increase our sampling in the local governments. So we had already established 20 decentralized sample collection points, but we're going to make those 20 collection points a lot more efficient and a lot more active. And indeed, we're going to increase that to 57. You may be going to a laboratory or a health facility or a pharmacy that is performing rapid diagnostic tests. Let me remind you, this is illegal. and it is dangerous. We have so far in the last 2 weeks shut down 2 facilities that are performing rapid diagnostic tests, and we are going to continue to perform sting operations. And if we find that people are conducting illegal COVID testing or rapid diagnostic testing, we are going to seal the facility.
The governor of Akiti State, Dr. Akiti, has advised Nigerians not to doubt the reality of the coronavirus. The governor, in a video released from isolation, says his state of health is not bad at the moment and he'll be away from the public as the protocol demands. He called on Nigerians and Akiti residents to keep safe at this delicate time.
If there is still anyone out there who feels that there is nothing called COVID-19, it is real, and it is important that you wear your mask, you wash your hands regularly, you social distance at every opportunity, and as much as possible, keep to yourself. That is the least we could do. But it is God who heals. We can only care. I thank all of our people, the solidarity, the effusive messages of prayers that I have received from across the length and breadth of Akiti State, across Nigeria, and even from outside Nigeria. Everybody has extended prayers to me, and I believe by the grace of God that I shall come out of this in one piece, healthy, physically back on duty, and rendering service to our people in Akiti State.
A public health physician joins us now via Skype, Dr. Ogunnaya Igwilo. Thank you for joining us on the program. All right, Dr. Igwilo, I'd like to begin by asking that, do you expect we're having high-profile cases who are coming out to say that they've contracted the virus, or also coming out to say that they have recovered? Do you think that this sharing, this experience helps in the fight, and this is against the stigma and all that concerns the virus?
It definitely helps, because remember that right now, we have enough, at least our national laboratory network has been developed. But the problem is people are not coming out to get tested. So even if we have 200 million test kits for all Nigerians, what it means is that Nigerians might still not come out. So, and this issue could be centered around stigmatization or even the misinformation that has been going on. So definitely seeing, high profile, like the minister, of foreign affairs come out, and tell Nigerians, and they see him go into the isolation center and come out. What it does is that it improves, it gives confidence, or it shows that confidence, or it improves confidence in our health system, and lets people see that, oh, this is just, it's just a respiratory illness, and people survive it and they even get better.
But what about for those who feel that perhaps it's still a lie and that this is all part of, the lie being told as to the existence of the virus in the first place?
So that is why it's so important. In fact, I think there was a documentary that BBC did with the Lagos University Teaching Hospital. Now, documentaries like that also helps, where, you see cases, you interview those even on the front line, like the doctors. It helps people see, at least people get to see what's going on, and that the illness can actually get serious when not, properly managed, or when people don't come in on time when ill.
So the Presidential Task Force is briefing right now on the pandemic, and it's also talked about access to more funds. Now, in terms of priority response, what would you say more funds should be spent on? More PPEs, more isolation centers, perhaps even more awareness?
And definitely, I'm thinking community engagement awareness, because the essence should be, where is the problem? Right now, the issue we're having is we have our laboratories ready, but people are not coming out to test. And people are not even, of course, people are feeling, don't want to get stigmatized, so they're not coming out. So definitely more community engagement, more awareness, trying to, get people to come out, those who are ill, bring them out, ensuring that people are also adhering to the non-pharmacological interventions, because that's really, really important.
So let's look at Lagos. We heard from the Commissioner of Health, and he talked about the Lagos modeling, saying that they expect that from that model, the virus would peak in August. What's your response to that?
So, like what happens with most, epidemics, so oftentimes we run what we call models to predict when, epidemics would climb up the curve and come down. Now, the issue about the modeling is any event that happens. For example, if during the upcoming Salah holiday, people now decide to flout the rules and end up creating more mass gatherings, you can even have that model change. So definitely right now, at our own pace, that could happen. But like all models, you could have changes because, humans were dynamic. Anything can change that, that pattern. And we can see, so we are hoping that it peaks and eventually comes down, which is what we're looking forward to, getting through this pandemic.
So it's also perhaps another reminder on the earlier model that Lagos will record about 90 to 120,000 cases at a certain time. So it's also interesting that this is coming. But do you expect that Lagos State, if it manages to peak and we will see a large reduction in cases, that this would also help the country, perhaps other states as well?
Definitely, I'm hoping it peaks and comes down. But remember, our issue is people are not coming out to test. So we're still having a large number of unidentified cases, probably infected cases that are still in the community. So most of our predictions are based on what we have, data we have. So definitely, we want to make sure that we are getting everybody who is probably infected coming, to get the care that they need, such that, after this model has been done, you now have more cases or more spikes cropping up later on. I think the main issue is still centered around people ensuring that, improving awareness, ensuring that community engagement is going on, at least every single time, such that you're having more people coming to get tested. If not, we might still have spikes subsequently.
We appreciate your time. Thank you so much, Public Health Physician, Dr. Ogunnaya Igwilo. Thank you.
Thanks for having me.
Let's take you now to Bauchi State, where the government has commenced community testing in an effort to stem the transmission of COVID-19 in the state. Our correspondent Hajira Aliyu reports that the process began in Turan Ward in Bauchi local government area with the call for the use of face masks and other preventive measures to limit the spread of COVID-19.
The Contact Tracing and Surveillance Committee is in one of the communities known as Turun, outskirts of Bauchi, to collect samples. This is in continuation of its active case search in communities. There are quite a number of procedures involved before a sample is collected. The individual must fill out the consent form and then the case investigation form. The Executive Secretary, Primary Healthcare Development Agency, Dr. Rilwanu Mohammed, is here to speak more about it. Doctor, tell us more about this exercise. Are people cooperating?
I really have to thank God for the first time we have started. This is a pilot. We have started with 3 local government, Bauchi, Kiripi, and Bogoro local government. Well, the first time we are here today, we really receive a lot of cooperation from traditional rulers, from the community. We have a lot of support, actually. Now, the rule is for the Nigerian Center for Disease Control is we must at least take 100 samples per day. And we are even taking about 300 samples now, or even 400 to 500 samples today. So we want to take massive sampling so that we'll be able to control the transmission of coronavirus in the community. We find out that most of the people that are coming with the virus are from the community. So continuous transmission is going on in the public, so we need to control it. That is the reason why His Excellency, the Executive Governor, approved fund. We're actually going out for pilot study in district local government to see where we have problems, where we can correct our method of approach to the community. But first of all, the risk communication came to this community, and synthesizing that we are coming for this activity. That's why we didn't find it difficult to start talking with them and start taking sample.
Okay, doctor, how long will this exercise last, and how much has been approved so far for this exercise?
His Excellency has approved for only 3 local governments. He gave us only 10 million for this work. Where we have issues is that when you take sample of the people in the community, and even those contact, when the sample comes out and the result is positive, the people will now have denial. They will now deny that, look, it is not me. Stigma and discrimination started coming in. So we have to feel the consent so that even if it is legal, we can take somebody by force. If he has agreed that he's going to do the testing and he now say no, he can't accept the result. That's the reason why we have the case investigation from all the information are required from him, are getting his telephone number, his temperature, all the necessary things, his present residence and his relation. And the consent form is really clear. And somebody must sign the consent form and agree that if that's happened, he will accept the result.
Okay, thank you very much, Doctor. That's the update we have for you from Bauchi. Hajara Aliu for COVID-19 updates.
Thank you, Hajara. We have more from the Presidential Task Force on COVID-19 when we return. Community spread of the coronavirus is rising, and with it, the risk of infection of persons at all levels in society. This is coming from the Minister of Health, Dr. Sage Hanire. The minister made the comments during today's briefing at the Presidential Task Force on COVID-19. According to him, cases recorded daily over the past week now fluctuate between 500 and 700 bracket, with it increasing numbers of infectious persons in community rising and at risk. He says government's focus remains prevention, which he says is better and cheaper than cure.
The COVID-19 cases recorded daily over the past weeks now fluctuate within the 500 to 700 bracket, with 543 new cases in the past 24 hours. Bringing our confirmed total number in Nigeria so far to 38,344, of which 15,815 happily were successfully treated and discharged. We have regrettably recorded 813 fatalities. We can rightly assume from the exponentially increasing numbers that the pool of potentially infectious persons in the community is rising gradually, and with that, the risk of infection for citizens at all levels of society, since a very significant number of persons testing positive may not show any symptoms and may not be in observation or treatment, and they are moving around among us.
Now, outbreaks linked to crowded indoor environments such as prisons, meat packing plants, a crammed call center, and also a restaurant has fueled the scientific debate over one of the most basic questions about the novel coronavirus and how it spreads. Medical virologist Joseph Ajibiwe joins us from our Abuja studios for more on this. Thank you for joining us. I'd like to begin by asking if indeed there is doubt that the virus is airborne, and that is transmitted through the air over time and distance by small particles.
Exactly. Good evening. I am Dr. Joseph Ajibiwe, a medical virologist. Actually, some new findings have shown that we have microdroplet transmission of the coronavirus. The earlier belief that you have to maintain some distance so that you will not be infected. But it's far beyond that, because we have microdroplet transmission, what some schools of thought termed as below 5 micron particles, below 5 micron particles. This micro droplet transmission. So even if somebody is speaking, if somebody is
breathing,
talking, okay, you can release the virus to the environment and it will remain there for some times from studies. Because most of the studies show that these particles can be captured, okay, from ordinary air.
Now,
so it is very, very possible.
So if that is the case, how then do we protect ourselves? Is the combination, the face mask, the physical distancing, all of that, is it a combination of that, or do we need to do something more?
Yeah, we need to do something more. Because the belief that when you wear nose mask, okay, you can prevent the transmission of disease or contacting disease is not fully correct. Because how do we even, how were viruses detected in the first place? Viruses were detected through microtransmission or through microfiltration, okay, through 6-filter. And when we talk about 6-filter is just like the porcelain filter we have in houses, like the common filter in the house. If you pour water, okay, it takes time before the water comes out. But if you put water on a cloth, immediately the water seeps out. So when we talk about viruses, they are in the range of nanometers, that is 10 raised to the power of -9. So they are very tiny particles. So using nose mask, okay, is not foolproof of viral transmission. And because of the micro droplet transmission, it makes it more terrible, which means if somebody speaks, okay, or even breathes, if somebody breathes or speaks, okay, the particles can still remain in the air several hours after leaving the location, okay? So it's a very, very serious issue.
So it's almost as if you're saying that people should stay away from each other. Because we've been told that you need to use a nose mask, you need to physical distance, you need to wash your hands regularly, you need to cough into your elbow and seek medical help, attention, if you feel the slightest way sick.
It's beyond that.
All right.
Because from recent studies from Nebraska in America, okay, it shows that this virus can be cultured from air after several hours of somebody releasing the virus into the air. So maintaining distance of 6 feet, okay, will not solve anything.
Okay.
And,
Dr. Ajobiwe, I know you have to come again on the program, but we'd like to thank you. Okay. Thank you so much. Wish we had more time on this. Go ahead.
Go further. To do something more. Okay.
All right. I guess still on the same point, needing to do a lot more to prevent ourselves from getting the infection. We close with what Uganda has recorded, the country's first death, according to a tweet from the Ministry of Health. Authorities say the victim was a 34-year-old woman who was originally being treated for pneumonia last week, and she died Tuesday and buried today. She was part of the support staff at the health center. Take a closer look at our website, channelstv.com. You can find the latest on the pandemic, www.channelstv.com. You can see all of the stories coming in there. More on the pandemic. You can take a look at what's happening in South Africa, the coronavirus toll after a rise in natural deaths. There's so many stories as well, all at your fingertips on our website. That's the program. Thank you for watching. I'm Millicent Nwaka. Stay safe.